Code Blue, Room 305. Code Blue, Room 305. Code Blue, Room 305.
There is no greater agony than bearing an untold story inside of you. Maya Angelou. Healthcare professionals working in acute settings such as emergency rooms, rehabilitation clinics, trauma units, or intensive care units face constant exposure to trauma. They often witness the pain, suffering, and death of patients, leading to what is known as vicarious trauma. This presentation explores brief therapy tailored to help mitigate vicarious trauma and foster a healing community. These interventions can be adapted to support professionals in various settings where they may be exposed to emotional and physical trauma, such as journalists and media personnel, educators, disaster relief and humanitarian aid workers, military and veteran services, and social services, including child protection. What is vicarious trauma in the context of healthcare? Vicarious trauma refers to the emotional, psychological, and physiological impact that witnessing trauma in others has on the caregiver or healthcare provider. Symptoms may include emotional burnout, exhaustion or detachment, increased stress, anxiety, or depression, difficulty separating professional and personal lives, and compassion fatigue. The consequences include reduced quality of care, higher turnover rates in healthcare staff, and erosion of professional empathy. Healthcare professionals in acute settings witness trauma, life or death decisions, and the impact of catastrophic injuries and diseases. They work long shifts, often with limited opportunities to debrief, recharge, or access mental health resources. Repeated exposure to patient trauma can lead to desensitization, emotional exhaustion, and difficulty maintaining compassion. There is pressure to perform at all times, and the constant demand for high levels of care can make self-care and mental health a secondary priority, exacerbating stress. Professional stigmas associated with vicarious trauma, which may prevent the healthcare professional from getting mental health support. Perceiving the impact of our work as a vulnerability. In many professional settings, acknowledging the emotional toll of our work is often misconstrued as a weakness. This perspective can foster a culture where feeling affected by our experiences with our clients and patients, or the nature of the work itself, is viewed as compromising professional competence. Emotional expression may be associated with diminished capability. Displaying emotions, particularly in high-stakes roles, may be interpreted as an indication of lower intelligence or as an inability to maintain professional detachment. This mindset can unfairly label emotional awareness as a lack of control or over-identification with clients, thereby underestimating the value of empathy and emotional insight in the therapeutic process. There is often an implicit expectation that professionals must avoid and suppress natural emotional responses. This approach disregards genuine reactions and their role in fostering human connection and enhancing the therapist-client relationship. Emotional restraint may be perceived as a boundary. While boundaries are essential, equating them solely with emotional restraint can undermine authenticity and inhibit the formation of trust and rapport in client interactions. The ABCs of vicarious trauma. A. Awareness. Be attuned to one's needs, limits, emotions, and resources. Pay attention to all levels of awareness and sources of information, cognitive, intuitive, and somatic. B. Balance. Maintain balance among activities, especially work, play, and rest. C. Connection. Communication is part of connecting and helps break the silence of unacknowledged pain. The 4 areas that can help prevent vicarious trauma. 1. General coping strategies. Fostering self-nurturing practices and connecting with others are foundational to maintaining mental health and resilience. These strategies include regular self-reflection, engaging in enjoyable activities, building supportive relationships, and connecting with friends, family, or peers. 2. Personal coping strategies. Establishing boundaries and prioritizing time for self-care are critical personal strategies. Individuals can protect their time, energy, and emotional capacity by setting clear limits, both in professional and personal contexts. Maintaining personal boundaries is essential to avoid burnout and maintain a sustainable work-life balance. 3. Professional coping strategies. Managing workload and ensuring regular supervision are key professional strategies. This involves carefully balancing caseloads to prevent overload, seeking adequate support through peer consultation or supervision, and engaging in continuing education to stay current and feel competent. 4. Organizational strategies. Creating adequate downtime and a safe, supportive environment within the workplace promotes well-being and retention. Organizational strategies should prioritize structured breaks, reasonable workloads, and a culture that values mental health. Providing a safe space for open communication, support from leadership, and access to mental health resources fosters a workplace that acknowledges and addresses the emotional demands on its employees. This is where my recommendation for weekly brief expressive arts therapy comes in to support the care teams. Why brief therapy? To begin with, there is a challenge of time. Healthcare professionals rarely have the luxury of time. They must manage multiple tasks and face immediate patients' needs. A 15-minute session during a shift break can provide brief but impactful relief, helping to mitigate stress and trauma. Brief drop-in therapy offers short, flexible interventions that can be integrated into the workday. Immediate access to support when needed without requiring large blocks of time. No appointments or long-term commitment, and frequent availability. Sessions are held regularly, allowing staff to participate when it fits into their schedules. Why community-based arts in trauma recovery? Community arts have proven effective in supporting healing after traumatic events such as natural disasters, violence, and mass tragedies. Arts-based interventions complement traditional mental health care by reducing psychiatric distress, including anxiety, PTSD, and stress. Adapted from community arts models, drop-in arts therapy offers an accessible entry point for mental health support. These sessions leverage creativity, social connection, and community healing to help mitigate trauma's psychological impact. The power of healing in community. The social connection builds a network of support, allowing individuals to feel understood by peers and colleagues with similar experiences. Collective strength reduces feelings of isolation, helping people recognize they are not alone in their struggles. Psychological safety is provided in a non-judgmental environment for expressing emotions and processing complex feelings. Community healing, especially for healthcare professionals, strengthens resilience and rekindles a shared sense of purpose, fostering ongoing well-being. Why the expressive arts? Nonverbal processing allows one to express emotions without words. It promotes empathy and connection through shared creativity, and it sparks imagination, bringing joy and color to stark environments. And an indirect impact are the neuroaesthetic benefits. as the artwork may enhance the healing environment for both the caregivers, the patients, and their loved ones. Initiative integration. A variety of weekly rotating art-based interventions will be set up at accessible hospital locations to maintain interest and relevance. The interventions will be in areas conducive to engagement, such as nurses' stations and communal family rooms, ensuring healthcare professionals can easily access them during their shifts. Clear and easy-to-follow instructions will be provided at each station to guide participation. A therapist will offer occasional support throughout the week, balancing patient care responsibilities. The activities are designed to be self-guided and adaptable to the schedules of healthcare professionals. Following are some examples of interventions. Collective playlist. A box of note cards will be placed at the nursing station, inviting the care team to share a song that uplifts their mood and helps them feel more resourceful and joyful. They can also create a visual representation inspired by the song while listening to it. The therapist will compile the submitted songs and visuals into a display for everyone to enjoy. Additionally, the therapist will create a shared playlist featuring the submitted songs, which will be emailed to the care team for optional listening. Mandala Stones. A collection of stones and acrylic paint pens will be placed at the nursing station, inviting the care team to paint a stone. Participants are encouraged to share their finished stones with colleagues, patients, or caregivers to foster connection and community. This activity promotes emotional well-being, mindfulness, and self-awareness. Participants can experience a calming and restorative practice that strengthens interpersonal bonds and supports their mental health. Poetry for resilience. Participants are invited to engage in a reflective writing activity, creating a short poem or mantra centered on themes of resilience, strength, or hope. Using the prompt, reflect on a moment when you felt proud of yourself or explore what resilience means to you. This practice provides an opportunity to process feelings meaningfully. By focusing on personal growth and inner fortitude, this activity encourages post-traumatic growth and helps build emotional resilience. Blackout Poetry. Photocopied pages from a variety of books along with Sharpie pens will be available at the nurses' station for the care team to create blackout poetry. A page is selected, and once the participant has read through the text, they use a Sharpie pen to black out words, leaving behind only the words that speak to them. The remaining words will form the poem. Examples will be available for inspiration. This practice offers a way to process emotions indirectly and allows subconscious thoughts to emerge. Healing soundscapes. Simple instruments like drums, chimes, shakers, and sound bowls will be placed in a designated family room, inviting the care team to engage in musical expression. This activity is designed to help regulate emotions and soothe the nervous system in a supportive and accessible space. Collaborative collage. A collective collage is an art-making practice that fosters community healing and strengthens team unity. In this activity, care team members are invited to create a shared artwork using collage papers and various images provided in the family room. The prompt encourages them to depict their experiences as acute healthcare team members, allowing for emotional expression and collective processing of their work environment. Unfinished business letter writing. Participants are invited to write a letter which will be sealed in an envelope and placed in the document shredding box for disposal. This process helps let go of complex emotions related to patient care and provides a safe space for emotional expression and release. If a healthcare provider has lost a patient, feeling any sense of grief, guilt, or disappointment, this is a safe opportunity to express anything that has been left unsaid. Gratitude tree. Paper leaves will be available at the nurses' station with a prompt to write something they are grateful for. These notes will be displayed on a communal tree for everyone to see and enjoy. The purpose is to highlight the positive aspects of their work and life, build resilience, and promote positive emotions among the care team. Intuitive movement. Images of various objects will be placed in the family room, each representing an archetypal energy. Participants are invited to connect with the energy of one of the images that resonates with them. They are prompted to move in a way that activates this archetypal energy within their own body. Movement can include stretches, gestures, or any motion aligned with the chosen archetype. Engaging in movement can promote emotional release and a unique way to connect mind and body and regulate the nervous system. The healing wall. Care team members are invited to write a moment of strength or healing on a blank note card and anonymously post it on the healing wall in a privately shared space. This practice is an opportunity to express vulnerability and foster emotional processing, build trust among the team in a safe and gentle way. Here are my references, and I thank you for witnessing my presentation.